Welcome back to the Healing Wellness Show, where we uncover the root cause solutions for chronic conditions that limit your energy, movement, and joy. I'm Dr. Karim, and today we're going to be tackling a topic that affects millions of Americans. That's neuropathy. From burning feet and tingling hands to numbness, balance problems, and even restless legs, neuropathy is often dismissed or masked with medications. But there is hope, and in many cases, healing. Today, I'll be answering real questions from real patients about diabetic neuropathy, chemo-induced neuropathy, idiopathic causes, which is unknown, balance challenges, amputations, fibromyalgia, and many more. If you or a loved one is struggling, this episode could change everything. So what I've got here is I've got Mark. Mark will be asking me the questions as they're coming along. Why don't you go ahead, Mark, and introduce yourself, and let's get going.
Hello, everyone. I'll be assistant host of The Most here. My name is Mark Anthony Stevens. This is a place where we ask questions from what other people are asking out here in social media. We see a major case in people having neuropathy days. Instead of cases going down, we're seeing cases going up. So today we'll be talking on neuropathy. And one of the first questions that we have right now, we have a question from Peter. One of his questions is, he's from Monterey, California. What is neuropathy really?
Well, neuropathy, simplest term is it's nerve damage. That could be in your feet, your hands, and typically it starts in those areas because those are the furthest away from the heart. So they're getting decrease in blood flow. Just what neuropathy is, it's nerve damage. Some of the causes, there's lots of them out there, but the main ones will be like diabetes type 2. And some people will say, hey, I don't have diabetes. Do I have neuropathy? It doesn't have to be diabetes. So out there from research, a third of it is known from diabetes type 2. A third of it is idiopathic, which means it's unknown. And then a third of it are conditions that are known to cause neuropathy, like chemotherapy, like alcohol abuse, like infections, like autoimmune conditions, like fibromyalgia, restless legs. So there's lots out there that are known to cause neuropathy or medications. So it really comes down to inflammation, poor circulation, and toxic exposure that affects the nerves.
So we have Diana from Salinas, California asking, is neuropathy the same as poor circulation?
They kind of correlate. Okay. So if your nerves are decreasing in activity, you're going to get poor circulation to it because the brain goes, hey, this nerve is not firing as fast as it should. So I'm not going to give it as much blood supply as I used to. So it tells the heart to stop giving it as much blood supply because it rather give it to more important things like your organs. So yeah, there's a huge correlation with, I always say it's three components really that affect the nerves. It's the nerve activity, how fast they're firing. It's the circulation because that's the oxygen nutrients, and then metabolic because that's where inflammation is coming from.
We have another question, and this is from Moses in Seaside, California. He's asking, what happens if I ignore my symptoms?
Well, neuropathy is just known, it's a progressive disease. So you ignore it, it's just going to get worse. Everyone's different. Some people it's fast progressing. Some people it's slow and it might take years. But the end goal of not treating it will be typically infections because you're getting poor circulation and that don't heal. It could be amputations. It could be disability where you're on the wheelchair, or worst case scenario is death because of infections and things like that.
Okay, that is amazing and at the same time not good. So the next question we see here is, why do diabetics develop neuropathy in the first place?
It's sugar. Sugar. That's why a lot of our programs will actually do gut health and trying to eliminate a lot of sugars to decrease inflammation. But yeah, diabetes is a huge concern with, especially in the US, the population. That's why we want to try and decrease a lot of diabetes. In our clinic, we do reverse a lot of type 2 diabetes, and that's just by changing what you're eating. A diabetes type 2, you cause that. It's what you're putting in your mouth, feeding your body is causing that. So if we change that, guess what changes? Your diabetes. That's the only one that we can reverse is type 2. Type 1, you're born with it. It's controllable, but it's not reversible per se for right now.
Wow. So yeah, I think you kind of almost answered the next question we had from Henry. He was saying, can I reverse it if I've been diabetic for years?
So if he's asking about nerves or diabetes, it's yes and yes. So diabetes, like I just talked about, diabetes type 2, we reverse that all the time just by changing the way you eat, doing a gut program, because a lot of times you've got leaky gut, and that starts to balance your hormones. So we have to check your hormones as well to make sure those are all good. With nerves, nerve is a cell, just like your brain is a cell, your heart is a cell, your muscle is a cell, your skin is a cell. So if I cut your skin, well, what happens? It heals, right? It heals itself. That's the same thing with the nerves. A lot of times it's not healing and it's deteriorating faster than your body's keeping up, and it's because you're doing something that is causing that restriction. So if we dig deep and get into the core root of the problem and figure out what is causing that and start to eliminate that or fix it, again, it comes down to the 3 components. It's the nerve education, so getting the nerves to fire back up again, getting the right circulation to the area. So a lot of times there's micro blood vessels are feeding those nerves that start to die off. So we need to create new blood vessels. And yes, you can create new blood vessels. It's a process called angiogenesis, which is something that we help with. And then the third component is metabolic, which is, again, your gut. It's your second brain. That's where 80% diseases come from. That's where inflammation comes from. Inflammation typically will target the joints. So if you're complaining of joint pain, whether it's back, knee, ankle, whatever joint, that's coming from the gut. And then usually after the joints, it usually starts to attack the nerves. So if we can eliminate the inflammation, get more circulation, get the nerves to fire, guess what starts to heal? That cell, that nerve cell.
Wow. Amazing. We have another question, and that is, what about those who've already lost a toe or are scared of losing more?
Yeah, definitely. I mean, you've gone through it. You know you're losing them. So if you want to try and avoid losing more, I would highly recommend coming and seeing us and see if you are a candidate for the program or not. Because if it's too far gone, it's too late. I mean, if there's no activity whatsoever in that nerve, it's too late. It's dead. So you'd be a great candidate to come and check and see if you are or not. We do detailed testing. Usually our tests take about 45 minutes to an hour to do, but we spend quite a bit of time getting into your history and figuring out what's really going on.
Awesome. One of the biggest things that we do not hear about is idiopathic neuropathy. Why can't doctors figure out the cause?
That's just, I mean, there's lots of factors out there. It could be something that you've done as a kid, like an injury, and you cause injury to the low back. The low back is where the spinal nerves come out, and those nerves start to branch out and go into your legs and feet. So, say you had an injury to that area and you've never fixed it or done anything to it. Well, over time, it just puts more and more pressure and decreases the nerve activity. So then that's where the brain goes, you're not working as hard. So it starts to cut off the blood supply. So it's just a chain reaction. Best way to explain it is think of those spinal nerves are kind of like a water hose. So if I've got the spigot open 100%, now 100% of water is coming out. Well, what happens if I put a big rock on that hose? Right now, maybe you got 80% of water coming out. Well, what if I leave it for months? Well, now maybe it's 70%. Leave it for years. Well, now it's 50%. That's kind of what's happening with restrictions on there. Could be medications. Some medications are known to cause neuropathy. Some it could be environmental. I mean, we have a lot of farmers that come in. A lot of farmers use chemicals in the fields, so there's toxins there. So there's multiple things, and that's why it's unknown to really hone it down to one thing. And a lot of times, people that come in our clinic, it's not just one thing that causes it. It could be multiple things.
We have George from Seaside, California. Could my prescriptions be contributing?
Yes, depending on the medication. Again, I mean, some medications out there that are known as big time cholesterol meds that are given like candy, which are statins. Statins are known to cause neuropathy. If you look in Europe, they're actually doctors are prohibited to prescribe statins because it's known to cause neuropathy. So that's one huge one. A lot of times when someone starts to have symptoms, they give them Lyrica, Cymbalta, Neurontin. These are all also known to decrease nerve activity, which again, nerves are supposed to fire at a specific rate. So why are you decreasing nerve activity?
Great answer. We also have one here by Jill Constantine saying, could I've been told my tests are fine, but I still feel off. What gives?
Again, that depends on what testing you've done. So we've got people that have come in and said, "Hey, I've gone to my neurologist and they've tested me," and they'll explain it. It's a painful test where they put needles in there and they zap you, and the test came out and said, "I don't have any neuropathy." Well, then all our testing is hands-on. We start testing, we test the brain, we test the spinal cord, we test the peripheral nerves, and guess what? Yes, you are having neuropathy symptoms. It could be the beginning, but you do have neuropathy symptoms. So if you want to be proactive and take care of it, then let's start. Let's do something about it.
And we have another question. This one's about chemo-induced neuropathy. Why does chemo trigger this?
Again, chemo is a very toxic medication. Yes, it is used to kill whether cancer or tumor. That's the function because, we want to get rid of it. But in hindsight, and they'll tell you that before doing chemo is you might have neuropathy symptoms. And yes, that will develop because it is damaging the nerves. So a lot of times if someone has gone through chemo, yes, we have helped a lot of chemo-induced neuropathy. Now, if you're going through chemo currently, I'd say let's wait till you're done because you're putting that toxic chemical in your body. Well, let's wait till you're done and then let's start treating it.
Awesome. Actually, a second question from the same lady is, can I heal after chemo?
Say that again.
Can I heal after chemo?
Yeah. Yeah. So again, nerves are cells, and what we're trying to do is heal that cell. Now, that nerve might not heal 100%, but if you've got, say, 80% nerve damage and we can get it down to 30% and live with that, isn't that better than 80? So yeah, so with neuropathy, a lot of times with patients, yes, they can get back to zero where nerve is working again, or a lot of times what we'll see is they'll plateau somewhere. It's usually around that 20-30%. But that's better than 90% when they first started, or 80%.
Amazing. Can neuropathy be prevented during cancer treatment?
If you're doing chemo and radiation, no. I mean, it's just, it's just like any medication, right? You take it, there's side effects. There's the side effects of that.
Okay, that makes a lot of sense. We have another question about peripheral neuropathy imbalance. How is this different from other types?
Peripheral neuropathy just means it's in your extremities. So what that means is it's in your hands or your feet. That's what peripheral neuropathy means. What was the first part to that question? Peripheral neuropathy and
Yeah,
what?
yeah. Yeah, we're talking about peripheral neuropathy imbalance. What
Oh,
is the
balance.
difference from other types?
Yeah. So balance, the reason why balance starts to get affected is again, it's that brain nerve function, right? If the brain is not getting the signals from these nerves that are going into your feet and it's not getting the right oxygen nutrients to heal it or keep it going at that same speed, then it starts to diminish. Well, when it starts to diminish, that's where you might start to feel that you're off because you're not feeling the bottoms of your feet anymore. Okay. So what you're doing really, okay. So if you're not feeling the nerves or the nerves in the bottom feel not relaying message to the brain so it can come back and tell you how to balance, then you're most likely using your eyes for your balance. So if you close your eyes and you start feeling like you're going to fall, and we'll get that a lot, like someone will say, "Hey, I'm in the shower and when I close my eyes, I feel like I'm going to fall." Well, yeah, you're using your vision for your balance. You're not using your sensation anymore.
Awesome. We have Julie. She's asking, why is my balance getting worse?
Balance is getting worse again. that poor circulation, nerve is not firing like it should to the brain, so the brain is not telling it how to balance. So technically, brain is not recognizing you have feet, even though you still have them. It's not recognizing you have feet, so that's why it's not telling it how to balance or how to function.
And we also have, I've already fallen. Can I recover my stability?
Yeah, falling is another part of balance. I mean, you're falling because your brain is not seeing that you're tipping. So it's telling you, hey, go the opposite side so you don't fall, and you just fall. So the signal isn't quick enough. So when we start to get the nerves to fire back up, the circulation to heal that nerve, the getting rid of the inflammation, guess what starts to come back? Your balance. And that's usually the last thing that starts to come back.
Okay, that makes a lot of sense and great answer. We have talking on this one on neuropathy, which it's all connected, is amputations and prevention. The question is, how can I avoid serious complications?
I mean, to avoid it is basically getting checked and doing something about it. I mean, that really comes down to it. If you don't get your neuropathy in control, that's where it will get to is infections. And the reason why you're getting infection is poor circulation. So you get a cut. So if you cut your hand and cut your foot, your hand will heal a lot quicker than your foot. And it's because of the poor circulation and the inflammation. And so it's not healing.
Okay, awesome. And the next question is, how often should I check my feet?
So check your feet. I mean, in what way? If you're saying like check your feet for testing, usually, in our clinic, we test, we tell you if you are a candidate for the program or not. If you are, then you get started and then we start to take care of it. Now, for our testing, we do that testing every 3 months. That's how often we do that to see what your progress is.
The question is, how can I avoid serious complications?
So I tell my patients to check their feet daily. And what that means is, hey, look at the bottoms of your feet, in between your toes, make sure there's no cuts, scrapes. If there are, then be proactive. Put Neurosporin, keep it covered, keep it clean so it doesn't get infected. You could wear supportive shoes and don't ignore injuries or falls. Really get those checked. With proactive care, amputation is avoided.
Awesome. And how often should I check my feet? Sally is asking.
Every night, every night. So if you can't lift your legs and look, use a mirror. Put a mirror on the floor. There's small ones that you can just put on the floor and check your feet. But any red spot, blister, cut, anything that just doesn't look right. Even different colors. I had a patient, I didn't realize he was stepping on a nail every time he put his shoe or his boot. And his wife was the one that noticed it because he was reclined. And on the bottom was a green spot. So it was infected. So any different colors on your feet, just get it checked out.
Awesome. And can shoes really make a difference?
Somewhat, yes. I mean, proper shoes could prevent like pressure points or ulcers, especially if you can't feel pain. But yeah, there are special shoes out there, but it's not going to fix the problem if that's what you're asking.
Okay, awesome. So our next question connecting to neuropathy is fibromyalgia and neuropathy. One of the questions we have is, my pain moves around. Could it still be nerve related?
Yes, I mean, fibromyalgia is known to be a type of neuropathy. Okay, so what fibromyalgia means for people that don't know fibromyalgia is it's pain, and it could be pain everywhere or pain in certain areas that comes and goes. The prime example is my mom. My mom had really bad fibromyalgia, and when she had flare-ups, it was just all over her body, and she'd have to take, a few days in bed to recover. And that's really why I started the neuropathy program, is I wanted to help my mom, and that's why I did. And that's why I searched and did lots of things out there and got my neuropathy program going. So fibromyalgia is often just including the small fiber nerves, and that's why you could feel that burning, stinging, zappiness. But yeah.
We also have from Brian in San Luis Obispo asking, is fibro a brain issue or more of a nerve issue?
Both. It's both. It's the nerves are inflamed and the brain just amplifies the pain signals. But we treat both ends of the system. That's why we do a full body testing. That's why I'm testing the brain, the spinal cord, the peripheral nerves, your circulation, your muscles, your reflexes. So lots of different things that we're testing to kind of figure out where things are working, where things are not working to create a full body program.
Awesome. Can people have both fibro and neuropathy at the same time?
Yeah, many do. I mean, many do. And with proper support, they often see the major improvements in pain and energy.
Awesome. We're going to be talking a little bit more about restless leg syndrome and metabolic syndrome. One of the questions is what's happening during a restless leg episode?
It's basically nerves are misfiring. And a lot of times it happens when you're sleeping because you don't have much control over your body anymore. So that's where you'll hear a spouse say, "Yeah, he kicks me in the middle of the night." I mean, it's just like he can't control it. But that's often the signal of early nerve dysfunction or dopamine imbalancement.
Okay. The next question is it all in my head?
No, we get that all the time. And that's why we always want the spouse there because they'll think that, oh, they're just making it up because they don't want to do chores or they're making it up because, they're just like complaining. And no, that's not really the case. That's why we want the spouse there so we can do the testing so then they can see really that's not normal. So it's neurological, but it's addressing the gut health, the sleep cycles, the nutrient level. So it really helps tremendously.
Great. Let's see. We have Cindy asking, what does metabolic syndrome connect to neuropathy mean?
So, metabolic, whenever I say metabolic, it's gut. It's your gut. Because remember, that's where 80% of diseases come from. That's where inflammation comes from. So, metabolic is, you say metabolic syndrome, it's a gut health issue. So, it's conditions like high blood sugar and belly fat increases inflammation. So, it kind of like chokes the nerves, the blood supply, and causes damage.
This next one is on emotional impact of neuropathy. How do I explain this pain to family who doesn't get it?
It's invisible, which makes it hard. So, metaphor like walking on broken glass or burning inside out. But that's where, again, when you're coming to get tested, bring that family member, bring your spouse, bring your sons and daughter. We've had that. So we can educate them and show them physically as we're doing the testing what's normal, what's not. And a lot of times, if they're still skeptical, I'll do it on them as well to show them the difference between them not feeling something or the spouse is feeling that. And they go, oh, wow, they're not feeling that. I'm like, no, they're not feeling that. That's not normal.
Okay, makes a lot of sense. The next big question is I feel depressed and isolated. Is that normal?
Yeah. So a lot of times people will start to feel that they're a burden on their family because they're asking them to help them a lot. Or we get it a lot with people that go on vacations with the whole family and they feel like they're a burden because they can't walk with them or do things with them, basically creating memories with them, right? So they feel that they're isolated. They're, it's like getting depressed because they can't get down and play with their kids or can't get down and play with their grandkids or. So you're not alone. We have many patients that feel trapped, and that's why uh, as a community, we give you that support. We help you with different aspects, and that's why having the family member there to see really why you're not able to do that, they start to understand and they're more compassionate. So seeing the progress is vital to healing.
We have Jeff asking, how do you help patients emotionally?
Like I said, we listen. That's the biggest thing is we need to listen to them. We need to dig in deep and see what that has caused, in their life. It could be their daily activities. They were active or they love to travel. Now they can't. So we really listen. We educate is the other big one is we need to tell you why we're doing this and why you're feeling that way. Or when we're doing testing, it's really we're explaining every test and telling them what's normal, what's not. So we actually build that roadmap to recovery so you're never alone on this journey.
We also have another one from June. How do you know if somebody is improving?
So remember we said we do that exam that we do initially, we do that every 3 months. Okay. So every 3 months, we're seeing what your progress is. So we're monitoring the nerves, monitoring the strength, the sensation, the balance. And then as you're coming in to see us, we're asking you every time you're in, any new pains, any new sensations, anything that's different, some people come in with discolored feet and you could start to see a difference with that. So really, progress is measurable.
And the next big question is, how long does it take?
Again, that's for every patient is different. I always say whatever we're doing for you, we're doing for your body. Your body is the one that heals itself. So some people might see that within the first 48 weeks. Some people it might be months. Some people it might be, years. It really all depends on the person and what's going on with their body. But that's why we kind of dig in deep to see what's the best modalities for that person. Some people might be one or two. Some people might be 10. So it depends on how much nerve damage you've got.
Wow. The next question right after that was, what's some of your favorite success stories that you can tell us on how you've helped people?
I've got lots. I mean, we've helped thousands of patients over the years. There's so many of them. I mean, the one that sticks in my head is that construction worker that was wearing his boots and had a nail stuck in it, and he would step on it and not realize he was stepping on a nail. And his wife is the one that found that his bottom of the foot is discolored. It's got a green spot and it was infected. And that's where he decided to do something about it because he would be climbing ladders and all that. And he was actually a roofer. That was his business. So he's always on top of roofs, but he couldn't feel the bottoms of his feet and it was just getting dangerous. So that's one that I like to share. But also, another one, a veteran who couldn't feel his legs, came in with a cane. That his biggest thing was he wanted to be he loved to dance but stopped dancing for a long time. He had his granddaughter's wedding coming, and that was his biggest goal is, hey, I want to be able to dance with my grandkids. I want to be able to dance again on that dance floor. uh, he started the program. He did everything we told him to do, and guess what? He was able to accomplish that goal.
Love it. Love it. If you can give us another, that's a really good success story. Let's do one more success story.
Another one, had a patient. He felt he was a burden on his family. And that's why he didn't go on vacations with them anymore, even though they wanted him to go. So his biggest goal was, hey, I want to be able to go on vacation somewhere near a beach with sand. I want to feel sand in between my toes again and be able to walk on it because uneven surfaces are just too tough for him at the time. Well, he started the program, started doing everything we told him, started to see a difference, and he did take that vacation with his family. And he came back and he bragged about it and he said, we booked our next vacation. So that's why we sit with people and figure out why they want to do something about it now. What's their goals? What's their motivation? If you don't have a goal and motivation, you're not going to succeed. So we want you to look towards a goal and get that going for you so you can succeed in the program and get better.
Sounds great, Dr. Mo. We appreciate you answering all these beautiful questions from these beautiful people, and we love what you do.
If you heard your story in any of today's questions, you're not alone and you're not without hope. I've helped hundreds of patients and I want to help you. That's why I'm offering the first 12 listeners who can call or visit our website a free nerve scan. And also, I'll give you a signed book. It's a copy of my book. This is a package worth $450, and that's completely free. So go ahead, give us a call. The number's on the screen, or visit our site. Also follow us on Instagram, Facebook, The Healing Wellness Show for stories, updates, and weekly wellness tips. Thank you for joining me on The Healing Wellness Show. I'm Dr. Karim. Stay strong, stay curious, and stay healing.